Hi everyone, it's Yasmin here. I hope you're all well. This week I wanted to speak all about vitamin D and why it is so important for our health, especially at this time as we enter October. So, what is vitamin D? Well, vitamin D is a fat-soluble vitamin, meaning it is dissolved and stored within fat within our bodies. Importantly, when we are consuming vitamin D, whether that's in food or a supplement form, it requires fat to be absorbed. So think of things such as olive oil, avocados, nuts and seeds, and oily fish. So why do we need vitamin D? Well, vitamin D is actually better classified as a hormone because it plays such a crucial role in many of our body systems, such as our bones, cardiovascular system, in our digestion, in hormonal health, immunity, fertility, and many more body systems. So while one of the main roles of the vitamin is to maintain normal levels of calcium and phosphorus within the blood, many scientific studies have also shown other areas and systems that vitamin D plays a key role in. So just to go through a few of those now, one of them is the immune system. So especially important at this time. Research has shown that vitamin D deficiency may increase our susceptibility to certain infections or viruses. Mental health is another area that vitamin D is important for. Research has shown that vitamin D deficiency is more common amongst those who suffer with anxiety and depression. It's also really important for our gut barrier function. It plays a role in sleep, in our weight, and also in controlling inflammation in the body. So it does have anti-inflammatory properties. So why is this important now, this year especially? Well, research has started to highlight a link between being deficient in vitamin D and that may put individuals at increased risk of testing positive for the COVID-19 virus, highlighting the importance of this vitamin to our immune function. So more research on vitamin D in the COVID-19 virus is definitely needed. However, the research so far does highlight some important connections, but it is not a direct cause and effect relationship at all. So where does vitamin D come from? Now, about 90% of our vitamin D is synthesized through our skin when we're exposed to UV light from the sunshine, meaning that the remaining 10% can come from foods or supplementation. So it is really important that we do get some sun time in the sunshine. As our sunlight hours start to decline at around this time of year, the government does recommend that everyone in the UK supplements with 10 micrograms or 400 international units every day of vitamin D from September to about March or April. So this recommendation includes breastfed babies. However, babies that are receiving more than 500 millilitres of formula milk per day do not require that extra supplement because it's probably in their formula milk that they are getting. Vitamin D needs to go through a few conversion processes in our body, in the liver, in the kidneys, before it enters its active form, which is vitamin D3. So supplementing with the active form, D3, is always preferable because that's in the most effective form that your body can use. So if you are looking at supplements, then do look out for vitamin D3 as opposed to vitamin D2, which can be found in many supplements. The main source, like I said, of vitamin D is sunlight. However, some food sources, such as full-fat dairy products, eggs, beef liver, fatty fish, and mushrooms that have actually been left out and exposed to the sun, can contain small amounts as well. So it is always essential to test your levels of vitamin D, as the government recommendations of 10 micrograms or 400 international units may be too low for some subsets of people, such as those who have a deficiency. And there is research showing that there is a much higher, safer limit or safer upper limit for vitamin D supplementation. So it may be that if you are deficient, you need to supplement at a much higher rate just for a short space of time to get your levels up to a more optimal level. Also, if you do have a darker skin colour, then you may need either more vitamin D or more time in the sunlight to synthesize the required amount. So fairer people typically need to spend less time compared to people with a darker skin. So I always recommend getting advice from a qualified doctor, nutritionist, dietitian regarding firstly testing your vitamin D levels, interpreting the results and finding the right dosage of supplement to suit you. And finally, using a reputable brand or supplement of vitamin D is really, really crucial. So please get in touch if you would like some further advice regarding your vitamin D this winter. Hope that was helpful, and I'll see you next time.